Mr. Jones, I'd really like to talk to you about your blood pressure. What I really want to do is talk to you about the different types of high blood pressure or hypertension, what it does to negatively alter your body, what can happen if you leave it untreated, as well as some steps you can take now to reduce the risk of that happening. First, I want you to understand what blood pressure is. So, blood pressure can be thought of as two ways. The amount of force pushing outward on the walls of your blood vessels, but also as a measurement of how hard your heart has to work in order to produce blood flow. So when you have high blood pressure, not only is it telling you that there's a lot of force within those blood vessels, but also that your heart has to work very hard to produce that blood flow, which is important. There are three forms of hypertension: primary, secondary, and complicated. Primary hypertension is the most common, and there's no real known source or single cause that can be identified. What it's normally considered is a combination of both genetic and environmental factors leading to this increase in blood pressure. The two main ways that it does this is through vessel constriction and an increase in blood volume. So vessel constriction is where your blood vessels, the diameter, get a little bit smaller and a little bit tighter, and an increase in blood volume just means that there's more volume that has to be pushed through these vessels. And when you have these combined, you have an increased blood pressure or an amount of resistance that your heart must overcome. Primary hypertension progresses over a long span of time, spurred on by these genetic and environmental factors, eventually causing alterations to your blood vessel walls, your blood volume, and eventually organs such as your eyes, kidneys, and brain. Some of the genetic factors that impact or influence the development of hypertension include race or ethnicity, family history, insulin sensitivity or lack thereof, as well as renal or kidney function. Whereas some of the environmental factors include obesity, lack of exercise, sleep apnea, among others. Secondary hypertension works in much the same way as primary, in at least its mechanisms. The difference lies in the source. So secondary hypertension has an identifiable source or underlying condition that leads to this increase in blood pressure. And actually, once you take that source away, your blood pressure will return to normal. Some examples of secondary hypertension causes or sources include adrenal gland issues or tumors, thyroid issues, and even certain medications. Complicated hypertension can be defined as chronic hypertension that eventually leads to an irreversible damage to your blood vessel walls. The damage to your blood vessel walls eventually leads to a thickening and a hardening of those vessels, increasing the resistance the heart must face, as well as decreasing the perfusion to your organs. So it's reducing, effectively, the amount of blood flow that gets to your organs. Organs such as your eyes, kidneys, and brain. Unfortunately, Mr. Jones, you have a lot of risk factors, a lot of factors that led to the development of your hypertension, and could also lead to the development of complicated hypertension, which, as we spoke about earlier, could cause irreversible damage to your blood vessels. Some of the factors that you face include your race, the fact that you're black, your family history, both your parents had hypertension and eventually passed away from it, as well as your mother's history of diabetes. Insulin insensitivity or diabetes is also a risk factor for hypertension. Some other factors I see here that you face include your alcohol consumption, your poor diet, a lack of exercise, weight gain of 20 pounds over the past year, as well as the high stress environment that you currently work in every day. A possible long-term result of your hypertension, if left untreated, could be heart failure. So with hypertension, we know that the amount of work that your heart must do to produce blood flow is increased. It has to work harder. Just like with other muscles, when they work harder, they get bigger. So your heart gets bigger too. This is good for the short run, but over time this can lead to a lot of negative consequences. Your heart isn't made to get bigger and thicker. It isn't made to have larger muscles. It's made to be slightly flexible and have the ability to contract very well in order to push that blood out. So when your muscles get thicker, you lose that flexibility, you lose that contractility, as well as decreasing the amount of blood inside the heart that has the ability to be pushed out. So when you do this, you have a decrease in the perfusion of your organs, which again could lead to irreversible organ damage, as well as system-wide ischemia, or a lack of oxygen. Fortunately, Mr. Jones, there are a lot of things you can do to efficiently reduce your risk of having heart failure and lower your blood pressure. The first of which I'd recommend is to start exercising and losing weight. Exercising could be as little as briskly walking for 30 minutes each day or most days of the week. This alone has been shown to reduce blood pressure. Losing weight, cutting back to a normal body weight, is the most beneficial thing you could do, however. Another thing you could do is to watch your diet. So increase the amount of fruits, vegetables, low-fat dairy products that you consume while starting to cut out total fats, saturated fats, and excess carbohydrates. Additionally, watching your sodium intake is extremely helpful in reducing your blood pressure. Recommended guidelines show that 2,400 milligrams a day of sodium is beneficial in reducing your systolic blood pressure, or the top number of your blood pressure. Some reports even say going as low as 15 or 1,600 milligrams is even more beneficial. And finally, finding a way, I think, to reduce the stress you have. You work as a police officer in a very high-stress neighborhood. Finding an outlet for all that stress will not only be good for your blood pressure, but for your overall health as well. Moderating your alcohol intake is also beneficial. Cutting down to no more than 2 beers a day could also reduce your blood pressure. By taking into consideration all of these environmental factors, you have a better chance of controlling your hypertension and reducing the risk of heart failure or other irreversible consequences further down the road.